When it comes to pneumonia, the UK is crap. More people die from pneumonia in the UK than any other European country. So this is clearly an important health condition. Today's video is about raising awareness about pneumonia. What is it? How do you recognize it? Differentiating it from other conditions, but also how to treat it, how to prevent it, and something a little bit more positive about it. Pneumonia is a serious infection of the small air pockets in your lung. And I want to differentiate pneumonia from chest infection, because sometimes we use the terms interchangeably. Chest infection is usually a virus where you have a bit of a cough here, maybe a bit of a sore throat, a runny nose, and you're having to really struggle on through it. Pneumonia might kill you. Sure, pneumonia could follow an infection like flu or coronavirus or a cold, but it has its own little features that help us identify it. The difference between pneumonia and the other infections is related to what pneumonia is and where it is. Pneumonia is a pocket of infection on one of your lungs. So it causes symptoms related to that. So like when you take a deep breath in, it might hurt, or just breathing in general might hurt. You might get short of breath, have a nasty cough, high fevers, sometimes to the point, especially in the elderly, where they actually get severely confused. Differentiating that from things like bronchitis, flu, coronavirus, all the other viruses, which tend to affect the upper airways. That's from the chest up to the throat and the nose, more likely to also make you feel really unwell, but more likely to give you not just a cough, but also things like a runny nose, feeling run down, aches and pains, but managing to soldier on, as opposed to pneumonia, which is life-threatening. Now, this difference explains why a doctor does what they do when you go to them with a chest infection. They take out the stethoscope and they listen to your lungs rather than listening to your chest. They're listening for pneumonia. And here's the tricky thing. Pneumonia isn't completely separate to the other illnesses. Those other illnesses that affect your more upper airways can actually pave the way for a pneumonia, a lower chest infection, to actually happen. If you have any of those nasty, what I would call red flag symptoms, which are here, then see your doctor about pneumonia. But if you're in the in-between phase where you've had what you know was a viral infection, and now is it turning into a pneumonia, here's a broad rule of thumb. The key is worsening symptoms, not improving ones. So a lot of people after a virus have this cough that lingers on a little bit for a number of weeks. That isn't quite pneumonia. Pneumonia is you have that viral infection and now you start to get worse. Your cough is getting worse, pains in your chest, coughing up more phlegm, bedbound, these sort of things, clearly heading in the wrong direction. That's potentially pneumonia. And here's the importance of treatment with pneumonia. I think most people, when they're worried about a chest infection, go to the doctor actually worried about pneumonia. And that's what the doctor is worried about as well. Because here's the difference. Pneumonia needs antibiotics. Your doctor should really not be taking a chance with pneumonia. They should be just treating it, because it has the potential to get a lot worse, especially if you're elderly. So it can lead to you needing oxygen, needing fluids, needing antibiotics in through your veins, and ending up in hospital. I'm getting mindful of what I'm saying about pneumonia today is very scary and negative, and in a way that's important because it is a potential killer condition. But the good news is this: antibiotics do work. So the standard treatment for antibiotics, according to guidelines, is 5 days of antibiotics should be enough. And that is evidence-based. That should be enough to kill a pneumonia. But here's the thing, on the ground, day to day, what I see is patients take their 5 days of antibiotics and they're on the mend and getting there, but by the 5th day, they're not quite there yet. Do you need more antibiotics? Well, the answer is usually not. And here's the reason. So once you've finished your 5 days of antibiotics, the infection itself, that pocket on your lung, should be killed, but it's not going to be and back to normal. That infection has done damage, it's drained your immune system, and it's drained your energy levels. So even once the infection has settled, it's going to take a little bit more time for healing to happen. We're talking up to 2 or even 3 more weeks. But so long as you're heading in the right direction, you can be reassured. There's a few important things to be said about preventing pneumonia. Ventilation, masks, all these things, they're not actually as important in pneumonia, and that's because it's not as contagious as all of the viral infections. So having lots of people in your house with similar symptoms means it's probably not pneumonia. Sure, it's a good idea to, wash your hands and open windows. That's still a good idea. But if you want to prevent pneumonia, you've got to keep your immune system strong in the first place. And there's 2 aspects to prevention that I need to tell you. One of them is smoking. Smoking is well known to damage your lungs and increase your risk, but everybody knows that. You don't need me to go on about that. The second one is vaccination. The pneumonia vaccine works well to prevent bacterial pneumonia. That's the dangerous one. And it is free on the NHS to certain groups. Those groups include people over 65, babies under 2 years old, or if you have certain health conditions like diabetes, heart disease, or a weakened immune system. So pneumonia is dangerous, and the earlier you spot it, the better. It can be tricky to tell the difference between pneumonia, flu virus, coronavirus, cold virus, and lots of other conditions because there is a lot of overlap between them. But I have got a video here to go through that in a bit more detail. Feel free to have a look at that. Stay safe, and thank you for watching.